Hi, my name is Leah Smith. I'm a licensed marriage and family therapist, a somatic experiencing practitioner, a certified massage therapist, and I'm also a NeuroAffective Touch practitioner. And this presentation is about neuroaffective touch. We're just going to go over why touch and therapy really can go together and why that's important. Touch is important because it helps bridge the verbal and the nonverbal. This way of working supports slowing down to allow time for the words to emerge through nonverbal pathways like visual, tactile, and movement. This way of processing can reduce shame for clients who have difficulty verbalizing the intensity of the emotion that they're experiencing. The first few years of our lives are spent without language. Touch can quickly reach into those nonverbal places. Somatic psychotherapy is about body mind integrated healing. As a somatic psychotherapist, I believe that the integration of talk and touch can be crucial in healing developmental trauma. Sensing, thinking, and feeling develop as a unified whole. So, why should we split these processes in our healing modalities? A child first learns to sense, and then the sensations become meaningful, and then the mind begins to make sense of what is being felt. And this is how beliefs start to develop. In NA Touch, we invite the body to bring forth its experience, and there is wisdom in what the body has to offer. Going back to this basic way of being curious about our internal experience, sensing first and then making meaning is a bottom up approach versus the top down approach of trying to figure things out only using our logic and reason. A basic principle of innate touch is believing the body's intelligence is equal to the mind's, and it's important to facilitate a collaborative partnership between the two. So, shock trauma requires completion of a defensive response, whereas emotional and developmental trauma requires repair to relational ruptures. So, in somatic experiencing, the difference between that and neuroaffective touch is that somatic experiencing focuses on addressing traumas that occur because of a physical shock. In a touch addresses trauma that occurs because of developmental trauma. So, what is developmental trauma? Developmental relational trauma are moments of broken connection, abuse, or neglect in the relationship of a child with the parent. Relational trauma seeks to repair relational ruptures that live within the self. We take those relational ruptures into our adult lives and continue to believe that relationships in our adult lives will reflect the relationships in our early lives. The techniques for working with shock trauma, like slowing things down and titrating overwhelming emotions, are a part of neuroaffective touch, but we add the importance of the relational piece. As someone processes a relational rupture while the NA Touch practitioner maintains a non judgmental presence, the body quickly responds to that reparative attunement. As practitioners of touch, you develop a capacity to hold in your own body a regulated energy that we can offer to the body of a person that has often not experienced attuned presence. When people with developmental trauma start to receive attuned, nurturing touch, they will express surprise about what it feels like to be touched in an attuned way that is respectful of their experience and how powerful it is to feel that being communicated on a bodily level. With this kind of attunement, a person will begin to drop into the first developmental movement of allowing the body to yield into being supported by another person. And this feeling can be described as feeling like quiet rest. For shock trauma, it's about completing the incomplete defensive response. For developmental trauma, it's about completing the incomplete relational connection with another person. When this relational completion is experienced, a sense of hope often comes, like maybe life doesn't have to feel so scary, or I don't have to feel so alone. Yielding is when we are connected to our back body and can drop into a state of relational trust, surrender, support, and letting go. We experience a sense of relational safety when we're in this state. A state of relational safety allows the unconscious to bring up whatever needs processing from past traumas that still live in the body. In other words, the relational movements that tell the story of our lives, like reaching, pulling, grasping, letting go, all originate from the movement of yielding. To support a person's development of the relational movement of yielding, a foam topper is on the massage table. Then there are going to be warm flax filled bags that we place on maybe the heart, the belly, and then a cozy blanket covers the body to give a sense of nurturing and comfort. And this is what is called a nurture surround. So, this is the setup for when you're experiencing a neuroaffective touch session. So, Antonio Damasio is a neuroscientist, and he wrote a book about emotions called The Feeling of What Happens. And this is a quote from that book. Sensory, emotional, and cognitive weave together to repair breaches within the internal relational matrix. When the ongoing brain mapping of the body is suspended, so is the mind. So the mind is there to receive the body's information. If we disconnect from the body, we no longer have access to information about our world and being alive. This mind body split creates a lot of anxiety because, on some level, our biology knows when there isn't a full circulation of communication. So, this is sort of a diagram of the process of neuroaffective touch. Sort of the first step is inquiring around identity. And so, as we make psychological inquiries around identity, we discover how we've made negative impressions about ourselves, the self hatred, the self rejection, the judgments that we make. And it's a neuroaffective touch therapist's job to help people understand where these negative impressions came from and why these beliefs are inaccurate. And this begins the process of someone developing self compassion. And you can see here as we go along the arrows, as we become, connected to our core needs and capacity, our restoration of connection and aliveness. We move along the graph, and this whole process begins to open up the body mind connection by supporting clients in becoming more curious about themselves and able to explore the sensations that arise in the body more deeply. However, this process isn't a linear one. We don't just move around the circle. We kind of bounce back and forth. And you can see here how this kind of begins the bridging of the mind and the body. So we might inquire into identity, and then we bounce into somatic mindfulness. So we deepen into the body around that. And then the body's wisdom sort of starts to inform why some of these self-hatred, self-rejection things, where they might have come from. And then we start to discover why they might not actually be true. It's really not a linear process. There's a lot of bouncing around. And as a person begins to discover this body-mind connection, they learn to start to notice when the mind is doing some processing and how to incorporate the body in order to be able to drop into that processing in a more deeply. This bridging process helps people discover what they might need or be able to ask for around what their needs are. As they experience attunement around their needs, they begin to internalize a sense of being cared for, which can translate into feeling cared about in the world. When we feel cared about, this builds confidence and self-esteem, an internal sense of self-respect and self-compassion. So in NA Touch, there are a few different types of touch that we use. And the first is holding, comforting, and caring touch. This kind of touch is the ability to fully rest into the support of another. And this seems to be what's missing for people with developmental trauma. It's the knowing that I can trust that the other person won't drop me. These pictures of animals being relational show how these relational experiences live in our bodies. This is the experience of relational yielding. Our body's ability to drop into relational yielding is so important for our nervous system. With trauma, when the body starts to focus on tracking danger, a kind of stillness establishes itself in the body. The rotator muscles along the spine are the first to go into freeze. It's the body's way of making itself small in order to feel safe. Helping these muscles return online tells the sympathetic nervous system that they are safe now. So these are some of the muscles that we will definitely address using touch to help awaken them, to help them come out of freeze. Innate touch allows the body to return to that melting, yielding connection. In psychoanalytic terms, it's the person finding their way to the experience of just being. This is when the mind turns off hypervigilance around attuning to others. That is my mom stressed, or how must I help her be more regulated so she can care for me? In developmental trauma, the mind gets recruited far too soon in trying to help the caregiver be the caregiver we need. And this pattern gets carried into adulthood. Nurturing, holding, and caring touch communicates safety and containment, allowing for a quieting down of the mind and an allowing of experiencing acceptance, support, and trust. This kind of touch supports the unwinding of developmental trauma. So, the next kind of touch is amplifying touch, and that's supporting awareness and presence. Amplifying touch means bringing touch to an area of the body to allow it to become the focal point. This usually happens by inquiring into where the person's attention is being drawn and supporting that area with amplifying touch, allowing them to strengthen the mind-body connection. For people who are very dissociated, numb, or have lost their connection to the body, focal point touch becomes really important in terms of rebuilding the highway between the mind and body. A light bounded touch allows people to begin sensing the body, and that allows people to experience a sense of, oh, here I am, I exist. This is the beginning of creating a sense of our own identity. And that's the piece that's really missing for people with developmental trauma, is that knowing self, that having a real sense of who one is, their own identity. And the next kind of touch is working, confronting, challenging, directive touch. This uses direct pressure to shift the state of the tissues. So it will release bracing patterns. It will give support to any kind of collapse that's in the musculature. It'll stabilize and regulate, and it highlights adaptive patterns. For early developmental trauma, a person first needs to experience a comforting touch to feel themselves being received and receiving before moving to this kind of touch. As we invite someone to yield to being supported, a person might say, I wish I could do it, but my body just doesn't know how to do it. That's when we'd respond by shifting our touch focus to help the musculature in the body learn how to let go. When we confront or actively press, it helps a posture or bracing pattern to release. This is important because the body has forgotten how to let go. We must challenge the bracing patterns by giving them a direction of reorganization so that they let go, and then we can return to those early needs for yielding. And then there's time for teaching and reflection. So this helps discover, practice, and integrate new behavior. After learning to relax and let go, it's important to give the mind and body time to reflect on how that creates a different internal experience and opens up different relational possibilities. For example, if we release the thoracic inlet, that's the shoulders here. It's often with people, you'll see the clavicles are coming up, the shoulders are pulling in. It's a way of protecting the heart, and it's a way of not allowing what's in the heart to arise into conscious awareness. So if we release that area, then the heart will experience an openness. And from that place, then all these movements can start to come forth. The arms really are the expression of the heart. So, like the arm reaching out for connection or the arm pushing to set a boundary. When this area is locked, these expressions are blocked. We're more just frozen, numb, not setting boundaries, being more passive, isolating, not reaching out for connection. These touch intentions are intended to support the expression of relational movements, which are yielding, reaching, pushing, grasping, and pulling towards us. These relational movements often get lost in families where it's impossible to feel oneself being received and attuned to. The body begins to internalize a sense of, I can't reach, I can't say no. Touch work helps these movements come back online, which means the person begins to experience themselves and the world differently. NA touch intentions support healing the developmental need to feel seen, met, understood, recognized, remembered, valued, appreciated, respected, confident in expressing needs and wants. The body tells its story about how these needs have been neglected by using imagery and sensation, and we can use our minds to help decode what these mean. Often the body's story is very different from the story we've held in our minds. Healing early trauma begins with offering the missing nonverbal experiences of somatic support, attunement, and safety, a secure bottom-up foundation based on trust and care from which a new top-down narrative can emerge. The three self states that are essential for secure attachment and emotional well-being are I exist, I am loved, my needs are important. Due to attuned, nurturing touch and presence, these self states begin to be internalized before we have language. So it would make sense that attuned, nurturing touch is an important place to begin repairing the impact of developmental trauma to help someone develop emotional well-being.